Hello there, and welcome. My name is Calliope, and I'm the nurse who's going to be performing your examination today. How you doing today? I see. I hope by the time you leave this examination, you feel even just the littlest bit better. Now, we are performing a head-to-toe assessment today. And to get started, I would like you to just confirm your name and date of birth for me. Wonderful. And is that your preferred name? How do you like to be addressed? Excellent. Now, to start with, I am going to do a short little neurological exam, but this assessment has many different parts. We're going to be looking at your cranial nerves. We're going to be looking at your eyes, your head, your heart and lungs, your extremities, essentially the entire package. Now, for our little neurological exam, I just have a few very simple questions. So if you could tell me, where are we right now? Where are we at? If you could be as specific as possible, down to the room perhaps. Wonderful. And what time was your appointment? Excellent. What is the date today? What is the date? Excellent. And what are we doing? What are we doing in this room? What is the purpose of us being here? Head to toe assessment. Wonderful. So you are oriented to time, place, person, and situation, which is very good. And then we're going to move to the head here. I've got several different little tests to do for this particular area. Firstly, I'm going to get up real close and personal. And from this point onwards, I will need to be touching you for the purposes of this exam. Is that okay with you? Do I have your permission to do that? Wonderful. So let's take a little peek. And I'm just going to get real close here. And we're going to take a look at the face and a little at the head as well. We want to note that everything is generally symmetrical, that we don't, for example, have any signs of a palsy or anything else out of the ordinary. And that our proportions are generally equal as well. Very good. And that the head is of normal size and shape. There, and the hair. And the neck. Wonderful. So let's just jot that down. And then we are going to, real quick, test the facial cranial nerve. Cranial nerve number 7. So I'm going to have you do some expressions. First, if you could raise your eyebrows, Good. And close your eyes real tight. Very good. And can you smile real big? Good. Puff out your cheeks. Excellent. And if you could frown. This one's hard for me to do on command. Very good. All right. Now I'm going to come in with some of our palpation. So this is where I start getting a little touchy. I'm going to be coming a little bit closer to you for that. And we're just going to do a little bit of palpation all around here. I want to feel the contours of the skull as well as the hair here. Feel around the face. We're just doing a general look. We'll get a little more, again, touchy as the exam goes on. This is just our little beginning introduction. Let me just take a look behind the ear there. Let me move the hair out of the way. Move the hair out of the way here. Wonderful. Good. And the hair itself, good texture to it, and I'm just going to test the strength a little. I'm going to wrap a strand around my fingers and give it a few pulls. Good. I'm just going to card my fingers a little bit through the hair and look for any signs of hair loss. We don't want to see, for example, more than 10 strands pulled as I'm gently working my hands through the hair. That would be indicative of some sort of hair loss, alopecia, something along those lines. Good. Okay. We are going to move to cranial nerve number 5. This is the trigeminal nerve. And I'm going to get a little tool to test that. Hidden right in my Tromner hammer here, we have a little compartment with a brush and a little pointed tip. So this is going to be our soft end. This is going to be our sharp. Just going to test this along your jaw here. So we have soft and sharp. Just like that. Did that feel distinctive enough? Very good. So the trigeminal nerve has sensory and motor functions. We are going to test the sensory functions firstly. So if I could just have you tell me whether you feel the soft end or the sharp end, right? Wonderful. So we're going to start. Sharp. Soft, sharp, sharp, soft, soft, sharp, sharp, soft, soft, sharp, soft, soft, sharp, sharp, soft. Very good. Let me put this back in here for safekeeping. And try to keep all the bristles, the brush bristles together. There. Now, let me just see here. Very good. Now we are going to work with some of the muscles of your face as well as one of the joints here. So I am going to be palpating the temporalis to start. So I'm going to have you just clench and unclench your jaw as I'm palpating around this muscle. So get a little feel here. And then I'm just going to have you clench the jaw, unclench, clench, and unclench. Good. Now let's work with the masseter. I could have you clench, unclench, clench, and unclench. Good. Now for the temporomandibular joint, right in here, I'm going to have you open and close the jaw. So if you could open the jaw, close, open, close. Good. Now we're going to test against some resistance. I'm going to be pushing against your jaw here, and I would like you to open your jaw against my resistance. So if you could open the jaw here. Good. And now I'm going to have you keep it open, and I am going to try to close it, and I want you to resist me. So if you could just hold that position while I try to close your jaw. Okay, very good. So your jaw is nice and strong there. You can go ahead and close the jaw and relax. And we're going to check your sinuses and your lymph nodes. So I'm going to start with the lymph nodes. We're going to come to the back of the head, underneath the hair here. We start with the occipital nodes, at the occiput generally. Work our way to the postauricular nodes behind the ears, and the preauricular nodes in front of the ears, and submental and submandibular underneath the jaw. That's what that sub prefix means, under. Then along the neck we have anterior cervical, posterior cervical, and deep cervical chain in here. Good. And then we have supraclavicular above the clavicle. We're going to feel right in here. Okay, and there doesn't seem to be any swelling in any of those. So for your sinuses, we're going to do some pressure as well as some direct percussion on the sinuses. So I'm going to press down on your forehead, your nose, and along the cheeks just let me know if it's painful or tender at all. We're going to press, 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 press. Good. How was all that? It's just fine. Now we're going to go in with the direct percussion, or the tapping with my fingertips. Just let me know if this feels painful or tender. All good? There. And how about that? Excellent. Now let me just jot that down. And we are going to move to the eyes. So first I'm going to do a little inspection here, like what we did before, just a little more detailed. So I want to look at the eyebrows, for example, that those are intact, the eyelashes, and I'm going to pull the eyelids up. I'd like you to look down so I can take a peek at the conjunctiva. Pull up, you look down. Good. And I'm going to pull down, and I'd like you to look up, please. Wonderful. So I'm going to pull down, you look up. Up, 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 up. Good. Good. Wonderful. The lacrimal glands look pink and moist, and the sclera is bright and whitish. Irises are clear. The pupils, as I'm looking at them right now, look to be normal. But we'll take a little closer peek at those in a smidge. Now I'd like to test your eye movement. We have cranial nerves 3, 4, and 6. For this one, we have ocular motor, the trochlear, and abducens. So I am going to have you follow my finger here, using only your eyes without moving your head, so we can track how your eyes move. Just going to come up, down, up, down. Good. The side, to the side, side, to the side. We're going to change it up just a little. Up, down, back to neutral, side, up, down, back to neutral, side. And this is called the H test. Tests all your cardinal directions of gaze. We're looking for nystagmus, lid lag, any sort of abnormality in the way your eye tracks an object. We'll go diagonally up, diagonally up, diagonally down, diagonally down, diagonally up, go ahead and look at those pupillary responses. We're going to bring out a Penlight here. If I could have you just look at my nose. I'm going to bring the light in so that we can check the pupillary response. Ideally, the pupils will be equal, round, and reactive to the light. Let's keep looking right here. That would be our normal response. Very good. And let's just come back one more time. Good. Very good. We are going to test your optic nerve, cranial nerve number 2, and we're going to take it over to our Snellen chart for that. I am just going to have you read the letters on this chart to the best of your ability. We're going to start with line 1 right here. You could read this letter right here. Good. And line 2. You could read this letter. And right here. Good. Line 3. You could read this backwards. Right here. Good. 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 And what about this line right here? Right here. Good. Good. Yep. And line number 5. We could do this backwards. Good. Yep. Good. Good. And line 6 here. Right here. Good. Yep. Good. 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 And line 7. Yep. Good. Good. Yep. Good. And line 8. We could read this one backwards. Good. Yep. Good. Good. Yep. Good. And let's try to see what we can do for the lines below our second solid line here. So number 9. We could try to do this one. Good. Keep going. Yep. Line 10 as best as you can. Good. Good. Yep. Just for funsies, let's try to do line 11 here. Good. Good. These are pretty difficult. Good. Okay. So for our ears, and I say that meaning your ears, of course, we're going to do a little inspection and otoscopy with the otoscope here. I'm going to have a little peek at your ears and just take a little look with We've looked behind the ears for any signs of lesion or abnormality. Here we're looking at the tissues of the ears and noting if there's anything that perhaps I need to investigate further. Of which, upon inspection, it doesn't look like it. So we are going to look inside the ears. I'm going to pull the ear up and back to straighten out the canal. I'm going to put the otoscope in your ear and take a little look. Up and back. And take a peek here inside the ear. So when looking in the ear, there is simultaneously not a lot going on and a lot of things. We have a lot of little things to look for, and there are a lot of moving parts, but it tends to be relatively quick, really. So, we will be looking at the vestibulocochlear nerve after our exam here, which involves a little hearing test. But it's really just taking a peek inside the ear and doing our little test, and that's the most of it. But there is a lot going on in those two small actions. We can look at the other ear here. Back. So, when looking at the ear, we have the ear canal, we have the tympanic membrane, but we also have a little bit of the inner ear. So, what we're primarily looking at is the middle ear, while the inner ear consists of your stapes, malleus, incus, and all the little organs inside. And we can just see the tip of the malleus here. We can check the tympanic membrane for perforation, swelling, color. We can look at the ear canal for blockage, for any irritation, signs of infection, redness, a lot of little bits in these small areas. And then we can test your hearing. So I am going to be just whispering in one ear or the other. If you could repeat back what you hear for me, right? Wonderful. Scarf. Good. Plaid. Vantage. Yes. Peculiar. Sourdough. Mercury. Orange. Wrap. Chocolate. Good. Plentiful. Auxiliary. Cortex. Composite. Very good. And all of those sounded rather clear for you? It wasn't a struggle to hear them? Very good. So, cranial nerve number 8. Here we go. Now we are going to take a look at the nose, mouth, and throat, and we have quite a few cranial nerves to look at in these areas as well. First, I'm going to start looking at your nose. I'm just going to take a look around. You don't have any difficulty with your sense of smell, taste, with your ability to breathe? No. Very good. Excellent. And I'm going to grab the otoscope and let me just pull off the speculum. Because that was just in your ear. That would not be polite. And I'm going to have you tip your head up so I can look inside of the nasal passages. And we can get a little bit of a view of the turbinates, but primarily I want to look at the septum and the passages themselves. So we're looking for perforation, swelling, discharge, irritation, things of that sort, but that looks good. I'm going to test your ability to breathe within each nostril. So I'm going to hold one side and just have you take a couple of breaths. So I'm going to hold this side. If you could just inhale, exhale, inhale, exhale. Good. Inhale, exhale, inhale, exhale. Wonderful. And was that difficult for either side to breathe through individually? No. Wonderful. Now I'm going to test cranial nerve number 1, our olfactory nerve. I'm going to test your ability to smell. I have a little container here. If I could have you just take a smell here. And if you could tell me what that smells like. Very good. That is isopropyl alcohol. Very easy. Now we're going to take a look at your mouth. We're going to do our inspection first, and then we have a few cranial nerves. If I could have you open your mouth, we're going to look inside. Little cavities here. And looking on the other side here. And the teeth here. For any signs of cavities. And if you could just lift the tongue to the roof of the mouth for me real quick. Good. Good, and you can lay that back down. Now I'm going to have you extend your tongue out of your mouth as far as it'll go. And I'm going to flatten it down. Good. Now, for the glossopharyngeal and the vagus nerve, we're going to do a couple of tests. So if you could just say ah for me. There, so uvula looks good and we are midline. Just going to look at the throat real quick. Good. Throat wall looks good. Alright. And if I could have you take a dry swallow for me. Yeah, it's a little difficult to do it on command, but you could do your best. Take as long as you need. I know sometimes it's kind of hard to convince your throat to do that. Take a swallow. Good. Now for cranial nerve number 12, the hypoglossal nerve, I'd like you to stick out your tongue and move it to one side, the other, up, and down. Wonderful. And you can put that back in your mouth. Good. So I am going to focus on the throat. We're going to start with auscultating the carotid arteries for any signs of bruits. If there were to be a bruit, I don't want to be feeling around in there. Take my stethoscope here. Good. And I am going to have you take a breath in and hold it so that I don't hear the rush of air in your throat and I can focus on the blood flow. So if I can have you just take a deep breath in. And exhale. Good. Deep breath in. And exhale. Good. We will be bringing this back shortly. Just needed to make sure to get the all clear. And I'm going to do some palpation here. We're going to palpate the carotid. I'm going to look at your trachea and thyroid. So let me just come to the carotid here. Got good strength there. The other side. Good. And if I could just feel the trachea here. Make sure that's midline. Wonderful. And if I could have you take a swallow again, I'm going to feel around your thyroid. So just do your best. 2 dry swallows in a row is very difficult. So take your time. Good and good. There we go. So that all looks good. Then we'll look at cranial nerve number 11 a little bit more with some shoulder movement. I'll check your head range of movement as well. So if you could just do a couple of shrugs for me. Just like that. Good. And if I could have you turn your head to one side, the other, one side, the other. Go up and down, up and down. Good. Can you tilt your head to one side and the other? One side and the other. Very good. Was there any pain or restriction in movement with any of that? No. Very good. So we are going to move to the upper extremities first, and then we'll come back to the chest. Firstly, I'm going to palpate a couple of pulses here. So I'm going to check the radial. And then I'm going to check both radial pulses at the same time. We're looking for what's called a radial delay. Just for a few moments, make sure they're essentially synchronized. And the ulnar pulse along the pinky side of the arm, and the brachial pulse in the crook of the elbow, the cubital fossa, depression in the elbow there. Very good. We have all of our pulses. Let's look at your fingers and your hands. So we'll check capillary refill, look at the joints as well, assess the temperature. So I'm going to start with the capillary refill. I'm going to press down on the nail and release, and see how fast the color returns to your fingers. They should blanch under my pressure and then flush back with color less than 2 seconds after. Good. Let's look at the hands. If you could show me the backs of your hands, palms to the floor. There. Good. Doesn't look like there's any nodes or deposits. The nails themselves look healthy and clear. If I could have you flip your hands over. Look at the thenar muscles at the base of the thumb, the hypothenar on the opposite side. And skin looks good, color looks good, and both sides are warm and dry. I'm going to palpate each joint here. Let me know if it's painful or tender at all. Just going to squeeze on each side of the joint, working proximally or distally to proximally rather, from the second joint to the first. And then I'm going to squeeze the sides of your hands. You could let me know if that's painful or tender. No? All good? Okay. Let's do a little bit of range of movement and strength testing. So I'm going to have you splay your palms open. Close them. Make a fist. Good. And if you could roll your wrists around, get a lot of cracking going on, back and forth. Good. And if you could cock the wrists back. Good. And bring them forward. Some flexion and extension going on. Very good. And I'm going to have you show me your elbows real quick. Just want to look at the skin on the elbows. Sometimes we can see signs of plaques here. Okay. I'm going to have you hold your arms like this, and I'm going to try to push you forward. I want you to resist me. Good. And I'm going to try to pull you towards me. I want you to resist me. Very good. And can you extend and flex the elbows? Good. Can you roll the shoulders forward and back? Very good. Now I'm going to test a couple of reflexes. We're going to bring out the Tromner hammer again. We're going to test the biceps and triceps reflex. If I could have you lay your arm on your thigh and let it relax. Let it go limp. And I'm going to come behind your arm here, and we are going to just good. Get the triceps reflex. And the other arm, if you could lay it across your thigh. Let it go limp. Let's let it relax. Good. For the biceps reflex, I'm going to hold your elbow and put my thumb in the crook of your elbow. I'm going to tap on my thumb, just holding the elbow. Just going to tap right there. The other arm, let it go loose. Very good. Very good. So, upper extremities. Now, one last thing before we move on to the chest. I'm going to have you hold out your arms here and close your eyes and hold them for a moment. We're going to check for any drifting, any abnormal movements, and you look pretty steady. Good. Go ahead and put your arms down, and let's go ahead and take a little listen to the heart and lungs. We're going to start with the lungs, and I'm going to have you take a deep breath in and out. I'll tell you when I need you to breathe. Deep breath in and out. 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 And for your heart here, I'm going to start up top with our aortic area. Pulmonary area. Pulmonary valve. Tricuspid. Mitral. Very good. So I am going to have you recline back and we're going to first look for any jugular venous pressure issues. So lie back and then just turn your head to the side for me. I'm going to come look. See how the pressure looks there. Good. And then I am going to auscultate the abdomen. And then we'll do some palpation. Just keep breathing normally here. Good. Listening around the organs. Good. All right, you're not going to need that anymore. And we're going to do some palpation. So we're going to start with a firm pressure and then work with a deep pressure. So I'm just going to press in with one hand to start. Let me know if any of this is painful or tender at all. All good? Okay, I'm going to go in with two hands for our deep pressure. Might be a little uncomfortable, and I'll just have you try to breathe through it. Good. Yeah, it almost feels like I'm trying to get to your spine from here. It's very deep. Any pain? More, I imagine it's a little tender, but out of the ordinary, out of what you wouldn't expect. Good. Good, okay. Give me just a moment. So, I'll have you come back up to sitting, and we are going to work with the lower extremities. So I'm going to get some pulses, and we'll check the capillary refill again. So first off, we have the popliteal pulse behind the knee in the popliteal fossa. And this one can be tricky. Sometimes you can't really feel it at all. There we go. Just need the right positioning. And we have post-tib and dorsalis pedis. Good. And those are essentially synchronized as well. So, capillary refill. We'll check each of the toes. Make sure the circulation is, circulating. It's circulating correctly. Very good. And we're going to check some of the strength and range of movement as well. So I am going to have you lift your feet up, and I'm going to try to press it down. I want you to resist me. Good. And I'm going to have you keep your feet down. I'm going to try to press them up. I want you to resist me. Good. I'm going to try to press your shins forward. I want you to resist me. And I'm going to try to pull them towards me. I I want you to resist me. Good. I'm going to press down on the tops of your knees. I want you to resist me from pressing them further down. Good. And I'm going to try to pull them up, and I want you to resist that. Legs are very powerful. This one usually doesn't end well for me trying to move you around. Now let's do a little range of movement. So if I could have you move the toes up and down. Good. And can you move the feet up and down? And inwards, out. Good. And can you give them a few turns? Rotate them inwards and out. Okay. Can you extend the leg at the knee? And put the legs down. Can you lift the legs up from your hips so that your thighs are coming off the table? Good. Put them down. Right, and can you move your legs out to one side at the hip? And the other leg. Okay, move them back. Good. And how was all that? Any pain or restriction? Very good. All right, so last thing, we're going to check your reflexes for your lower extremities. I have a Babinski hammer here, or rather I have a Taylor hammer so that we can check the Babinski reflex using the blade here of the hammer. So I am going to take your foot here and I'm going to stroke the sole of the foot with the blade. And we get the toes curling. Good. And stroke the sole. Toes curl. Very good. We'll bring back our Tromner hammer for the patellar reflex. I'm going to have you relax the leg. And then I'm just going to tap on the knee. Very good. Other side, relax the leg. Very good. Let me just good. And that looks like we are finished. Very quite pleased with your results. I don't see anything out of the ordinary at all. Did you have any questions at all? Okay, I'm going to sign off. And that will conclude our head-to-toe assessment. I'd like to thank you so much for coming to me for this assessment. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation, or our throne wish list for props and equipment. Thank you again, and I hope you have a whale of a day and a good rest of your night.